we're measuring the risk for ourselves. So when you measure the risk for yourself in a time like this, you say, oh, well, am I likely to have an adverse reaction from the vaccine? And then you also have to say, what about the people around me? If I get COVID, are they likely to get COVID and can they survive it? And the reality is that from a public health perspective, we're making a sacrifice. We're choosing to vaccinate ourselves so that the people who are the weakest in our population are protected. And that's what you do when you're a compassionate person.
Welcome to the LearnSkin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, I think we're just talking about all this vaccinations here, vaccinations there, vaccinations on the podcast, right?
Oh, yeah. We had already one episode talking about people with skin conditions, but then we got so many responses and people are curious because be it if you're a dermatologist, a rheumatologist, just a general practitioner, every person coming into my office has questions about the vaccines. And boy, I'm just a dermatologist. I need some more information from a trustworthy kind of resource.
Sounds like we need a Ph.D. in immunology. Neither of us have that, but we have our favorite integrative immunologist joining us yet again, Dr. Heather Zwickey, and she has got a Ph.D. in immunology and microbiology from the University of Colorado Health Sciences Center. And she is at the National University of Natural Medicine in Portland, Oregon, and she's the founder of the Helfgott Research Institute. And she established the School of Graduate Studies. They've been developing programs in research, nutrition, global health. But we have really good conversations with her around immunology, and I can't think of a better person to talk vaccines than you, Heather. Thanks for joining us.
Thanks for having me.
Yes, Heather, and I believe you are officially a vaccinologist. Is that true?
Well, my PhD was actually working on a vaccine for tuberculosis. So yes, I don't currently work on vaccinations, but during my PhD and in my postdoc at Yale, I was working on vaccines for cancer. So I have a lot of experience with the different technologies that are out there these days.
Right. And I believe you advise to national boards and such and lecture extensively on the topic, right?
I do indeed.
Fantastic. This is really good because, one of the first things that I am encountering in clinic all the time is this misunderstanding about how these different vaccines work. Because one of the first questions I'm getting is, should I get this vaccine? Should I get that vaccine? Maybe we can start by an overview of what's out there right now, at least in the United States, and how these vaccines work.
Sure. So there's currently 3 vaccines available in the United States. There's the Pfizer vaccine, which is an mRNA vaccine, the Moderna vaccine, which is an mRNA vaccine, and the Johnson & Johnson vaccine, which is an adenovirus vectored vaccine. The vaccine that's on the horizon is the AstraZeneca vectored vaccine as well, very similar to the Johnson & Johnson vaccine. So do you want to know how they work?
Yes, please. Tell us.
Okay,
Absolutely.
So let's start with the mRNA vaccines. So the fact that these are mRNA vaccines has a lot of people scared because they see the word RNA and they think, oh, this is going to integrate into my DNA. And is this going to affect...
Absolutely, yeah. That's what everybody thinks.
That's
Totally.
what everybody thinks. But that's not what happens. So what happens is we make mRNA of the spike protein for coronavirus in the lab. And then we take that mRNA and we surround it in fat, in lipids. And so it's mRNA surrounded by fat. When it gets injected into your arm, the first thing that happens is that a cell type called a macrophage picks up that mRNA and carries it to the nearest lymph node. Now that lymph node is in your armpit. And so now that mRNA is in your armpit of whichever arm you got vaccinated with, and it's going to recruit in your immune system, your T cells and your B cells that are specific for virus. those cells are going to expand. And when they expand, that lymph node in your armpit is going to swell. So a lot of women are actually concerned that they've developed breast cancer after they get this vaccine because they have this swollen lymph node in their armpit. That's just the immune response. That's where it happens. When the T cells and the B cells are created, they kill off those original macrophages that carried the mRNA. The mRNA is only in your system for about 48 hours before it's completely eliminated by your immune system.
So just to be clear, that mRNA is gone after 2 days. All of
After
that is
2
gone.
days, it's gone.
So nothing goes into my DNA. I'm good. All right.
Nothing
Thank
goes
you.
into your
I'm
DNA.
reassured. All right. Go ahead. Meanwhile,
You've now got this army of T cells and B cells, and the B cells are the ones that make the antibodies. So you've got this army of cells that can respond if you were to be exposed to coronavirus. The vectored vaccines work similarly, but a little bit differently. Instead of starting with RNA, we start with an adenovirus. Now, an adenovirus is a common cold virus. And what we do is we take a little piece of the SARS-CoV-2 RNA, we turn it into DNA, we do that in the lab, and then we insert that DNA into a cold virus. That cold virus now is made what we call replication deficient, so it can't expand. Now we give you a cold, only we're going to do it by injecting it in your arm. And because so many people have already had reactions to colds, we've all had a cold by the time we're an adult, right? So our immune system already knows how to respond to an adenovirus. This adenovirus is just a little bit different because it's got a SARS-CoV-2 gene in it. And so our immune system makes a really good response to the adenovirus. Again, it happens right in your armpit, and the virus is gone within 2 days, and you have an immune response that is now primed for the SARS-CoV-2 spike protein. Now, it's important that both of these are working specifically on the SARS-CoV-2 spike protein and not the whole virus. So we're very dependent on the immune response to SARS-CoV-2, just the spike protein.
we've heard on previous podcasts that we did that these are found to be in clinical trials, which were pretty robust, found to be pretty effective, right?
Oh, very. They're very effective. So we do efficacy studies when we're studying them in ideal situations, and then we do effectiveness studies when they're in the real world. And we just have data in now showing that they're 90% effective in the real world. So that's excellent. That's better than most of our current vaccines.
That's fantastic. And, Heather, I think one of the questions that has come up, frequently is, some people are really worried about getting the vaccine because the reaction and, sometimes people also worry about the safety of the vaccine. Let me just come out and ask first and foremost, getting the vaccine can't give you COVID, right?
No.
And also, can you also speak to why do some people react more than others?
Yeah, this is a great question. So people react differently to the vaccine, the same reason that some people react differently to COVID. So first of all, there's difference in genetics. You might have different genes than I do. That means that you have a different immune response than I have. We also have different microbiomes. This is that, part of our gut or our skin that we think about a massive effect on our immune system. We all have different vitamin D statuses. So our vitamin D status will change our response to a vaccine. And some people have a better immune response to coronavirus. Remember, coronaviruses have been around for decades. And so likely you have responded to a coronavirus at some point in your past. Whether you responded to a coronavirus that was more similar to COVID or less similar to COVID could impact whether or not you're going to have a massive response to the vaccine or you're not. And then age and gender and time of day, like all of these things make an impact on how you respond to a vaccine. So literally think about this. When you wake up in the morning, your cortisol spikes, and that cortisol spike is slightly immunosuppressive. So if you get your vaccine earlier in the morning, you're less likely to have a reaction than if you get your vaccine later in the day. Simple things like time of day.
Exactly. Yeah. And it makes sense. And I think Roger was asking a question that I don't want to pass by. He was asking, because that's a common question that we hear, is can you get COVID from getting the vaccine?
Oh, no, absolutely not. You cannot get
Good. I
COVID from
wanted to
getting the
make sure that
vaccine.
that's clear
Yeah,
out
yeah,
there.
yeah.
And I think the confusion from your great explanation on how these vaccines work, I think that's where the confusion usually lies, because people hear that you get a piece of the virus coming into your body and you think, oh my God, I'm getting sick like that. All right, good. So thank you for clarifying this.
No, you know why people get sick from the vaccines is it's what you're actually experiencing is the immune response to the vaccine. So the immune response to the vaccine is similar to the immune response to COVID, but it's not identical because you don't actually have COVID. So
Right.
the part that makes you feel sick is called interferon alpha, and that's why people are getting headache and muscle aches. And then when they feel fatigued, that's from another protein called interleukin 1. And when they feel anxious, it's from another protein called interleukin 6. So there's all sorts of different proteins that are interacting to orchestrate your immune response to the vaccine. And that's what's making people feel sick.
Yeah, I have a question there then in regards to that. A lot of people are taking all kinds of supplements right now to try to, keep their immune system in peak position or, really primed to respond. They're drinking reishi mushroom teas, or they've got echinacea on board, or they've got astragalus, whatever it is that they're doing. Should they back off of that when they're getting this vaccine? Would that create an overreaction? What are your thoughts on that?
Yes, I actually tell people that I don't want them to take a lot of supplements before vaccination. These particular vaccines are strong enough on their own that you don't need any additional immune response. The only supplement that you might want to consider when vaccinating is a probiotic, because the probiotic is modulatory, right? It will increase the immune response if you need it and decrease the immune response if you need it decreased. So that's really all I suggest.
And speaking of this topic, some people were asking me if having a good response, meaning feeling ill, makes you more immune versus lack of that kind of response. Because I know personally, when I got vaccinated, I felt great. I had a little ache in my arm. 2 days later, no problem, ready to go. Got the second shot, not a problem. And I know some people really, especially after the second shot, feel really bad. And the question is, if I, who felt great after the vaccine, am I less immunized?
No, so this is what I was trying to get at earlier. The variation in the immune response to the vaccines are immense, right? And you might have had a lesser response or less symptoms from your response, either because you have a stronger response to coronaviruses. And so you had a reaction that was so fast you didn't even feel it, which is what happens when we have immunological memory to things. Or it could be that you're so super stressed that you're immunosuppressed. Or it could be that you have some sort of genetic difference than other people's, such that you didn't have a good response to the vaccine. And we can't tell which of those three it is.
Got it. But there's no known correlation between the level of symptoms and the degree of immune
There is
that a
not.
person raises. Right.
That's
All
correct.
right. Good. Excellent. So I think we've clarified a lot of this. So I'd like to move to the next topic because this is a big one, and that's the issue of pregnancy. A
Yeah.
lot of women are thinking about it. There's a lot of rumors going around. Should you get the vaccine? Should you not? Is it going to affect the fetus or not? What do we really know at this point about women that are pregnant and the vaccine?
So, what we know is that there's a shared sequence of amino acids between the SARS CoV 2 spike protein and a receptor that is found on the placenta. If there was going to be a reaction, so what we call that in science, it's called molecular mimicry. The two proteins share a sequence of amino acids, they mimic each other.
And why is that important?
That's important because it means that if you have molecular mimicry for a protein, that if your immune system sees one protein and then sees another protein that looks just like it could attack. Here's the thing. We know that for the immune system to attack for molecular mimicry, we need 8 amino acids to be identical. And the sequence of shared amino acids for this particular protein is only 4. So we don't see any cross-reactivity. We don't see molecular mimicry happening with this particular protein. Hypothetically, when people were proposing this, it sounded like a good hypothesis, but we also know that more than 44,000 women with COVID have had successful pregnancies. And we think that it's because this sequence is so short that molecular mimicry is not occurring.
That's good to know. That'll put our minds at ease for the most part. Are there any risks that a woman does have if they're pregnant, or is there any risk to the pregnancy, maybe in the sense of not perhaps affecting the baby, but maybe premature birth? Or do we have any data on any of that aspect of things?
We have data on that with COVID. We don't have good data on that with pregnancy right now with the vaccines. So with COVID, we know that COVID can drive a very strong response to viruses, which we call a Th1 response. Now, women make what we call a Th2 response when they're pregnant to protect the fetus from any viral infections. And a Th1 response can cause preeclampsia in a woman, which could lead to premature births. Now, here's the thing. These vaccines also cause a very strong Th1 response. So could the vaccines lead to preeclampsia and lead to premature birth? Hypothetically, yes, but we don't know. We don't have data. There's a study happening right now of 800 pregnant women to look at whether or not these women will have adverse reactions to the vaccine and if there will be adverse effects on their fetuses. So we should have data shortly, but we don't have the data right now. We only have the hypothesis. If I were pregnant personally, I would just wait until after I gave birth to get a vaccine.
And just steer clear of other people then.
That's right. Do what you've been doing for the last year.
Thanks for your thoughts on that. So we do have a little bit of a lightning round of questions for you that we'd like to get through. And then we'll talk a little bit more about just globally who should get vaccines first. Are there people that we have to also consider maybe they don't need to be the first in line to get these vaccines? So let's first start with the first question. If someone has anaphylaxis to bee stings or peanuts or perhaps eggs, should they get vaccinated, or does it matter on which one of those they're reacting to?
So if someone has anaphylaxis to things that are not in a vaccine, they shouldn't have an anaphylactic reaction to the vaccine. However, the vaccine companies have said outright that they are worried about anaphylaxis. And so if you choose to be vaccinated and you've had an anaphylactic reaction to something other than a vaccine, then you should let the vaccinator know so that they can have an EpiPen ready in case you have a reaction. Highly unlikely that you're going to have a reaction if you're just anaphylactic to bee stings or peanuts, but let someone know so they're prepared.
Makes sense. Now, talking about the second dose, could people skip that? Is that a reasonable approach to getting immunized?
So the Moderna data showed that the first dose was effective in people who were under the age of 55, and they had as strong a reaction to the first dose as they had to two doses. However, the FDA approved a two-dose vaccine, so they have not yet approved a single dose. Moderna has applied for approval to just have the single dose because if you're under 55, a single dose is enough. If you're over 65, they showed in their data that the single dose was not enough for a strong reaction. So if people had a bad reaction, or could they skip the second dose? They could, or they could delay the second dose. And it might be that in the intermediate time, the FDA is going to approve single dose, especially for the Moderna vaccine. The Pfizer vaccine, it's less clear that a single dose is going to be effective. Just their data wasn't as strong as Moderna's.
Now, what are your thoughts on when people are going to get these vaccine passports and whatnot? Until the FDA approves a single dose, should people try to stick to getting the two doses if possible if they want to get it officially signed off? If
That's
they do
exactly
get the
right.
Moderna vaccine?
Yeah, that's exactly right. If you think you're going to travel, you probably need both doses because other countries are requiring them.
Right. Okay. So next question coming at you. If someone has autoimmunity and they have a known autoimmune condition, how should they be approaching the vaccine, or should they be worried?
This is a great question. So there's a difference between controlled autoimmunity and uncontrolled autoimmunity. If people have controlled autoimmunity, meaning they're on medication and they are not having flares, then vaccination has actually been shown to be fine. The MS Society came out with a recommendation that if you are controlled with your medication, the medication will also control your reaction to the vaccine. So you're fine with vaccination. But if you have uncontrolled autoimmunity, vaccination could cause a flare of symptoms. So if you're not controlled with medication or natural products or acupuncture or whatever it is, then you might want to delay vaccination, or you might want to choose to be vaccinated with the Johnson & Johnson or AstraZeneca vaccines, because these vaccines tend to be less stimulatory of your immune system than the mRNA vaccines.
No, I think that's great advice. And the good news is the Johnson & Johnson is now available, and stay tuned for AstraZeneca, at least in the United States.
The last one I want to ask is about boosters. So is that really a strategy? Is that coming up and we're just not sure of it? And if it does, how's it going to work? How often do I need to get a booster to maintain my immunity?
Especially with these variants running around, if you can comment on that too.
Yep.
Heather.
Yeah, that's the big thing. So when we saw the immune response to the mRNA vaccines, I was thrilled because the immune response looks like the immune response you get to tetanus, which means that we would only need a booster once every 10 years. And that's really what we're seeing for the cycle of coronaviruses, right? We saw SARS and then we saw MERS and now we're seeing SARS-CoV-2. It's every 10 years. And so that was kind of exciting to me. But the fact that we now have variants, well, that's now less exciting because we don't yet have a variant that is not responsive to the vaccines we currently have, but we could develop a variant that is non-responsive. And then what we will see happen is like what we see with the HPV vaccine, where you'll have a single vaccine that started with 4 strains, and then it moved to 8 strains, and now it's at 12 strains. And we just keep adding strains of virus to the vaccine to make the vaccine effective. So hypothetically, we could be in a great situation where we don't need a booster for 10 years. But if these variants keep rearing their ugly heads, yeah, we could be in a flu situation where we have to get a shot every year.
Got it. All right. Well, I guess we'll have to stay tuned for that and see how things go.
Exactly.
Great. And then, one of the segues we wanted to get to was talking about, are there people who may react so much to the vaccine that it could actually be a threat to their own life? And I know that this is, just to have an honest conversation around vaccines, the vast majority of people are not going to overreact. And we know that even if you have a reaction, it's going to be fine. But I do want to talk about, are there certain people that may be at higher risk to overreact or really tax their system if they get a vaccination? And who would those people be?
Yeah, that's a really good question. And people are very concerned, and, rightfully so, that there are some risks associated with vaccines. Every medication has risks, and vaccines are no exception. In our strategy with vaccination, usually what we try to do is we try to vaccinate the healthy part of the population so that people who shouldn't be vaccinated because they are at a high risk for an adverse event are safe because everyone else around them is vaccinated. So who is at risk for, extreme reactions to these vaccines? The mRNA vaccines are very strong. They're very taxing on the immune system, and the very elderly are absolutely at risk for adverse reactions. If we look at the number of people who have died, and the data is old, the last reported number of deaths was in January. That was 169. Out of the 169 people who have died, 120 were living in long-term care facilities. So these were people who were already very sick. And the other people who have passed away, we know have extreme underlying health conditions. Now, this is a real challenge, right? Because these are also the people who are most likely to die from COVID. So, of course, they want to get vaccinated because if they get COVID, they're going to die. And we can't predict who's going to die from the vaccines. It's a very, very small number. 169 is minuscule compared to the number of people who've been vaccinated. But it still feels frightening for somebody who is going to get their shot. And I understand that.
I really appreciate you putting that in context. I think sometimes we'll hear about these negative statistics and we'll think it overdrives the entire statistical pool, but that's not how it works. I mean, like you said, it's a minuscule number. We just have to acknowledge that there is this very tiny number and perhaps do our parts so that those people will never have to see COVID, or really reduce the chances of them ever having to deal with COVID face to face in the end.
That's absolutely true. And I think that the other thing that we're all doing is we're measuring the risk for ourselves, right? So when you measure the risk for yourself in a time like this, you say, oh, well, am I likely to have an adverse reaction from the vaccine? And then you also have to say, what about the people around me? If I get COVID, are they likely to get COVID and can they survive it? And the reality is that, from a public health perspective, we're making a sacrifice. We're choosing to vaccinate ourselves so that the people who are the weakest in our population are protected. And that's what you do when you're a compassionate person.
You could have not said it any better. And that's one of the things I'm trying to tell my friends, colleagues, patients around me, that, these are difficult times and we're all required to step up and do something, be it wear a mask, keep some distance, be reasonable. And one of the things is take a shot in the arm and maybe not feel good for a few days. And that may be protecting someone who's, 97 and immune suppressed and should probably not get the vaccine. But at least we're making our small part to kind of be a protective shell around that person.
That's exactly how I think about it too. Yep.
Well, listen, this has been a really tour de force through the vaccine and really common questions. And I'm going to ask our listeners to post questions because we may ask Heather to come back if there's more questions about the vaccine. And maybe in a few months, we'll know more and we'll have some new data. And Heather is our vaccine person, our vaccine guru. So thank you for your time, for your expertise, and for being so clear and explaining things in simple English that even I could understand. Thank you so much.
Always fun to talk with you guys. Thanks for having me.
Hey, Raja, what are you doing this October 22nd through the 24th?
There's only one right answer to that question: the 4th Annual Integrative Dermatology Symposium.
Of course. Now, a question. Are you going to travel all the way to Sacramento, California to meet me in person, or are you going to join virtually in your pajamas?
Pajamas in person? Well, you might see me in pajamas at the Sheraton Grand in person in Sacramento, or maybe I'll be in a Jolly Folly costume. Who knows? But I'm excited to chair this hybrid one-of-a-kind conference with you, Hadar.
Well, man, I do love this unique event our team just put together. This is an event that really takes an integrative approach to common patient questions, also an integrative approach to challenging dermatology diseases. We also are going to cover aesthetics and have practical takeaways to start using in the clinic right away, just when you come back. So, this is the kind of information I just can't find with any other meeting.
So true. And the good news is it's not just for us. It's for practitioners of all backgrounds, and everyone is welcome. Use our discount code IDS25 at checkout for 25% off registration. And you can find us at www.integrativedermatologysymposium.com. Come say hi and tag us on social if you'll be there. And our tag is @Integrative Derm Symposium.
We hope to see you there.